This is one that I hear all the time, so I'm really excited to talk about it. And people ask me every day, if I get lip filler, am I going to look like a duck? The answer
is
yes. Always. Welcome back to Lipstick and Lipo, your unfiltered guide to plastic surgery. My name's Dr. Ashley Amalfi. I'm one of your co-hosts. I'm up in Rochester, New York, and I'm joined by my friend Smita, Dr. Smita Ramanathan, and she's in New Jersey. Hi, Smita. Welcome.
Hi everyone. We've got another awesome topic tonight, huh?
I know. So many fun little myths that we're debunking and questions that we hear every single day, you guys, about filler. And this is one that I hear all the time. So I'm really excited to talk about it. And people ask me every day, if I get lip filler, am I going to look like a duck? The answer
is
yes. Always. And the answer is no. I mean, and that's because you're seeing people who are walking around with bad lip filler. Lip filler will make you look like a duck. It's someone who doesn't know what the right product to use and where to inject, right? Because you can make beautiful lips with filler that do not look like a duck.
Exactly. I mean, you can make beautiful lips that don't even look like you have filler in them. I mean, that's the point of all of this, right? Is to just sort of enhance your anatomy, your lips.
Yes.
And so they look exactly like what you would normally kind of have. But yeah, the duck lips is a big deal. And I think it's because, unfortunately, you can really go anywhere and get fillers, right? And especially the lips, it's just such a scary popular place to get it that people will go into whatever shop down the street and get fillers, and it doesn't literally everybody is doing it. So
young people
I think
too.
I think exactly. They start young. And
lip fillers is more common in younger people. So it's not just people who are aging, it's people who just want their lips to be bigger. And I worry sometimes that these younger people are more price shopping, right? Whereas our more mature patients understand a little bit more about why they need to see a certain kind of core physician or a med spa with core physicians. And I think some of the younger people are just it's cheap and it's all the same. That's what I see.
Yeah, I see that too. And I also think it's just one of those things that's so common that you sort of forget that it's still a procedure. There's still risks involved to it. And if you have a complication on your lips, it could be sort of devastating, right?
Yes.
Yeah, it can be really bad.
Hair color. It's not like hair color. And you can't even get good hair color. And you can't even get good hair color everywhere. You get what you pay for.
Literally. Exactly. That's what I was just going to say. I mean, the amount of time and effort we all spend to find the right, stylist and the right this and go to the right salon. I mean, the fact that we don't do that with fillers that are literally injected into our face is beyond me. But that's
needles.
That's a whole other topic. But yeah,
that's true.
So I think it's sort of you sort of just think about it it's just a little lip filler, whatever. But then the problem is you do have a lot of people walking around with these fake, unnatural duck lips.
Yeah. And I think there's kind of two reasons that happens. If you have duck lips, it's either because it's the wrong product or it's in the wrong place. So either they use something that's too thick or that moves around a little bit more than what we want to happen in the lip. Or they just did it and injected in exactly the right place, because it's a very intricate anatomy there. And if you get just beyond that border, it bleeds into this upper white part that connects your nose and your lip. And then that white lip stick out. And that's when from the side, it sticks out and looks super weird and looks like a bill or like a duck bill.
Yeah.
And so I think that those are the two reasons that it happens. But a good lip filler should never look like a duck. We shouldn't even use those words.
We shouldn't even use those words, right? I mean, that's the thing. And the lips, I mean, look at how much we use our lips, right? Eating, talking, whatever it is. So the anatomy is really, like you said, it's intricate and it has to move and look natural. And so fillers that are injected along like, the wrong filler or along the border, that's where you really get those unnatural results. And then just too much filler,
Absolutely.
People sort of lose track of, I think filler, it's really easy in the lips where you forget, the second the filler starts to dissolve or the swelling goes down, a lot of people are just like, I need more. Well, you can have too much in the lips,
Yes, more is not better.
More is not better. But I think, again, as with everything else that has to do with cosmetics, if you go to the right person with the right training and the right education and the right technique, it's sort of hard to get any of these negative results.
Yeah. So going along with that, so if you get filler and then the swelling goes down and you think you want more, sometimes it's better not to just get more right away, to just wait until that filler goes away. And then the next time you come in, we can use a thicker viscosity or something that just gives you a little bit more pop as opposed to just adding. And I think that just gives a more natural look. We just do a better job at choosing the right product for you instead of more and more and more.
Right. Yeah. I mean, I 1,000% agree. And I think, like you said, the product also for the lips too, there's a lot of flexibility, right? I mean, you can have, if you want more of that substantial augmentation, more of that pop, you might go with a little bit of a thicker filler versus, I know when I do my own lips, I like a really thin filler because I just want it to look more like it's hydrated rather than the augmented look.
Yeah.
So, that's the cool thing. So if you go to, again, you go to someone who is sort of an expert and can talk to you about all these little details and intricacies of the procedure, but it's not just walk in through the door somewhere and just get stuff injected into your lips because
no way.
Sometimes that's not going to, end up where you want it to. So
No. So definitely possible to have gorgeous natural looking lips. Make sure you're seeing a core physician, and we don't want to see any duck lips. There's certainly none on our pages, so check it out.
No duck lips here.
Do your homework. Yep, no duck lips here. All right, you guys.
Well, this is another great topic, guys.
See you soon. Another question. Bye, Smita.